For those who just joined us, welcome to the meeting. And now I'll send it back to you, Didi.
Thank you, Zacchaeus. Next slide. For our agenda today, we will have a Heat Relief Network update, Valley Metro update, City of Phoenix update, COVID-19 updates. We'll have an agency spotlight from the Scottsdale Training and Rehabilitation Services with STARS. I will provide a regional human services transportation update, and then we will also have updates from our sub-regional mobility managers. Next slide. For our first agenda item, I just wanted to say, you're living in Phoenix in the summertime when you say today is a little bit cooler and we're only going to get to 106 degrees. This next agenda item is really important and offers information on resources available regarding the heat. Many of us today deal with the vulnerable population of older adults and persons with disabilities. And we thought this would be very important information for you to take back to your organizations. I would now like to introduce Kelly Donna Williams. If you have not met her, she is the Human Services Director here at MAG, and she will be presenting on the Heat Relief Network. Thank you, Kelly.
My pleasure. Thank you so much for having me this afternoon. It's lovely to be able to share this information with you, and I appreciate the invitation. Next slide, please. The Heat Relief Network was created by the Maricopa Association of Governments in 2005. Next slide, please. After we had a pretty significant heat wave, I always chuckle to myself when we talk about heat waves in Phoenix in the summertime, not that having individuals die related from heat-related illness is at all funny, but having been born and raised in the Phoenix area, it's always hot. It seems like it's always hot. And whether it's 110 or 115 or, higher than 115, obviously it's very dangerous. But unfortunately, a week-long heat wave in 2005 is really what got this work started, when we had quite a few individuals who were mostly unsheltered individuals die from heat-related illness. And community stakeholders came together to say this is unacceptable. We recognize that our unsheltered population has significantly increased in the last several years in addition to this. And so now more than ever, our heat-related activities are really important to make sure that there is some sort of shelter for individuals to come in to be able to get something cold to drink and cool off during the hottest hours of the day. Next slide, please. So what does MAG do related to the Heat Relief Network? Our primary responsibility with this work is with our RAD team, which stands for our Regional Analytics Division. They have built an interactive map that shows all of the different partners across what we call our region. So it's not just Maricopa County, it's Maricopa County, 3 tribal nations. We also have partners in Pinal County as well. A wide variety of community volunteers come together to say that they want to provide one of these 3 things. They either want to be a cooling center, they want to be a hydration center, or they want to be a donation site. A cooling center is someplace where people can actually get inside in air conditioning and get something cold to drink. It could be a library that also offers a water fountain, for example. It could be a place of worship that's opened its doors during off worship hours, again, to allow people into the air conditioning and providing bottled water, perhaps in that scenario. A hydration station is different in that a hydration station provides shade, not necessarily air conditioning. So you may see these if you're driving around in downtown Phoenix, the pop-up tents, where there may be a couple volunteers, some folding chairs, and a cooler full of water. Again, allowing individuals to get out of the direct sun, have something cold to drink, and hopefully cool off. And then finally, which is quite obvious, a donation center. We have lots of folks come forward this time of year and say, we really want to be involved. We want to help those who are vulnerable in our community for heat-related illness. How can we pitch in? We put donation centers on the map so folks know where they can go to donate bottled water, hygiene kits, etc. Next slide, please. So the goal is to educate the region about heat-related dangers and also how folks can come inside during the hottest hours of the day to protect themselves. We often talk about this information as though it is specifically for individuals who are experiencing homelessness. But truthfully, and especially now with increased housing prices in the Phoenix metro area, we are really concerned with individuals living on a fixed income. So it could be older adults who can no longer afford to keep their air conditioning on all day. And so they're having to be strategic about how they spend their money to be able to keep their homes. We want to make sure that those folks do not stay in their homes if they don't have air conditioning on during the peak of the day as well. We're also concerned about individuals who work outside during the heat of the day. You may have postal workers or landscapers or other individuals. Those folks can often get overheated as well. And so we want to make sure that anybody who's outside during the heat of the day in the Phoenix metro area during this time of year from May 1st through September 30th, recognize that our map is a tool they can use to find the location closest to them to be able to get outside of the heat and get something cold to drink. Next slide, please. So how do we put this together every year? We create an application on our website. We do ask our partners to reapply each year. Part of the reason for that is, as you can imagine, with over 200 participants across the region, things change on a regular basis. The map is updated regularly for hours of operation, the contact information, if there's certain supplies that need to be are being requested, et cetera. And so we put out the application. It is on our website at that link. We ask applicants to complete it. If they've applied before, it takes maybe a couple minutes to complete. If they're a new application, it may take 5 to 10 minutes. It's very basic information. But again, we're gathering some really specific things, such as, are you a hydration center? Are you providing air conditioning and water? Or excuse me, are you a cooling center providing air conditioning and water? Or are you a hydration center providing shade and water? Or are you a donation site? Then we put all of those into our mapping application, which again is interactive. You can search by zip code, you can search by hours open, you can search by those 3 different categories that I mentioned, and it really does give you a comprehensive understanding of the resources that are available through the Heat Relief Network across the region. Next slide, please. We do this in partnership with a wide variety of organizations, but our primary partner in this work is ASU. ASU runs the Cooling Center Response Network, which is another entity that we walk right alongside with. They coordinate not only donations of materials, but also donation of volunteers and time as well. And so if we have individuals contact us and say, I'm retired, I can volunteer on Tuesdays and Thursdays, I want to be a part of this work, we send them to the Cooling Center Response Network, and they can help pair them with sites that are looking for volunteer hours as well. And they have a decentralized donation network, as mentioned. And again, I'm sure that Dee Dee and Hezekiah will be able to get you these slides. You can click on those links and it'll take you right to the site if you're interested in more information. Next slide, please. So what does this look like longer term? We had 383 deaths in Maricopa County alone last year due to heat-related illness in Arizona, just in Maricopa County in 2021. We are really hoping to reduce the number of individuals who are dying from heat-related illness, fully recognizing that our unsheltered population has increased, and we do have more families living on the brink of eviction for a lot of reasons, including older adults on fixed incomes. So how can we help? We want to make sure that people know how to get to the library that's closest to them, if that's a heat networks site, or perhaps it's a YMCA, or maybe it's a house of worship. There's a wide variety of different locations, and it's up to all of us to be able to share this information. So we really encourage you to get on our website, to play on the map, to share it with your networks, and to make sure that those who may be vulnerable in your life know how to use it as a public health tool. Again, we're welcome to your feedback as well. If you have any questions, if there's other things that you think that we could be doing with the map or with the network, we're willing to listen to those suggestions as well. My email address and phone number are there. Please feel free to contact me. And you can also connect with us on social media. Another part of our work with this is when we do have those excessive heat warnings, we make sure to send it out through our social media. But again, we recognize that the May 1st through September 30th Heat Relief Network timeframe is really the period of time of life in the Phoenix metro area where if you're not careful, you can die from heat exposure, and it can happen to anyone. Next slide, please. Okay, I think those are the end of my slides. Thank you very much for your time today. Again, it is up to all of us to help reduce heat-related deaths. If you have any questions, please feel free to reach out. I'm exceptionally thankful for Dee Dee and Hezekiah for leading this work for our team at MAG, and we're so happy to have you all here today, and my hat is off to you. So thank you for your important work. Have a great rest of your afternoon.
Thank you, Kelly. And as Kelly mentioned, we will have this information. We will have the presentation on our MAG website. We will send out that information to you. And also, it is really important, and this is why we provide all these presentations with all of these resources that we would more than happy for you to take all of this information back to your organizations, your communities, your agencies, and share it with others. As Kellyanne noted, if you have any questions now, you can put them in chat, or if you want to email myself or Ezekias afterwards, and then we can forward those on to Kelly. So thank you so much for this valuable information. Next slide. And before we get to our next agenda item, we just want to share who do we have in our audience today. So we do have a polling question, and the polling question is, what type of organization are you representing? Is it a government agency, a municipality, nonprofit, private for-profit, citizen, or others? And we will give you a couple of seconds.
Okay, 94% completed.
And okay.
And here we have the results.
Okay. So just to let everybody know, 61% of us here today are from nonprofits. We do have 24% from government agencies. Welcome municipalities and government agencies, municipalities at 13%, and private for-profit agencies at 3%. I'd like to welcome everybody here today, and thank you for sharing that information with us. I would now like to introduce our next agenda item. We have Wyatt Scarf, who is the Paratransit and Right Choice Program Supervisor, and Guillermo Gonzalez, the Valley Metro Program Coordinator for Accessible Transportation Services, who will provide updates on Valley Metro. Thank you.
Good morning. Can everybody hear me? Perfect. Okay. Hi, my name is Guillermo Gonzalez. Thank you for the introduction, Didi. And we work here at Valley Metro. So next slide, please. So I just wanted to give you a little quick COVID-19 updates. We are encouraging social distancing, but it is no longer required. And we are encouraging face masks, but they are also not required. With paratransit, we have our trips that are slowly picking back up, and we have brought back all our furloughed drivers. However, we do continuously still need more drivers. So the contractors are still working very hard to hire more drivers. If you'd like more information on everything that's going on with COVID, there is that website, valleymetro.org, news safety /security, everything that we're doing with that. Next slide, please. So just to go in a little bit about our ridership, for the months of February, March, and April, on the bus, as you can see, it has increased a little bit, but it's kind of leveled off as well. With light rail, it did increase quite a bit, but if you look at it from the perspective of a graph, it has kind of leveled off as well. Paratransit did increase by quite a bit, but it did come down a little bit in April, and the summer months, as it gets hotter, does tend to decline a little bit, but it has increased overall. And then Right Choice is slowly increasing as well. Next slide, please. So as we talked about ridership, I wanted to kind of introduce a little bit about our travel training program. It is a one-on-one travel training program, and it gives the opportunity for people with disabilities and seniors to become more independent and get out and about in our transit system, whether it be the light rail, the new trolley, circulators, or the regular bus. It is individualized training, and the best part is it is free. So I just kind of want to talk a little bit about it. So on average, a person that goes into excuse me, that goes into travel training. They, excuse me, they go into about 3 sessions in order to graduate. So the process for that is that they fill out an application, they go through an assessment. With this assessment, we're going to make sure that this customer is appropriate for our travel training program. Once that is done, our travel trainers go out, they do a route and scout. So they check out the routes that they want, do the planning of the trip, and then do the sessions with the customer. So our travel training program has been increasing year after year. Fiscal year 2018 to 2019, we had 117 customers graduate. On fiscal year 2019 to 2020, we had 127. And then this fiscal year, we have 180 as of the end of May. So it has increased quite a bit. We are getting a lot of more applications coming in. So it is an in-demand program that people are starting to notice. This program does include other options too, such as Train the Trainer, where we actually go and invite organizations to come to our office for a workshop, where we teach people how to use the bus and how to teach people how to use the bus or the light rail. If you have customers that want to learn how to use transit and you want to do it in your organization, we can give you the tools necessary for you to successfully do that. And on top of that, if they do graduate and go through your program, all we have to do is have them come into our program, go through one session, we confirm that they've learned it, and they're eligible for a 1-year bus pass. And that's for all graduates as well. One thing that I would like to say is that we had, like I said, mentioned 180 graduates. So far, we've done 539 sessions. We've received 439 applications, and currently we have a 78% graduation rate. The reason our rate is not in the 80s and 90s is we have a lot of the large amount of coming from the shelters, and we can't get a hold of them. So they'll do like one session or they'll do the assessment and then they've disappeared. So we have to consider them as a discontinued customer. But in general, our graduation rate is much higher. And I kind of wanted to give you a little bit about a couple of stories regarding our travel training program, because it is dear to my heart, because it actually gives people an independence that's aside from paratransit and services like that, because they're the ones choosing when they're getting picked up because they know the bus routes. So recently we had a formal travel training customer. So he had already graduated and he came back to get recertified for paratransit, because some of our customers can do some trips on the bus, but not all trips. So he came back and he was telling us all about what was going on. He got recertified with the travel training, with the transit evaluator. And then he went and talked to one of our travel training instructors. He explained that he got a new job because he was let go of his previous job because of COVID and how they were laying people off. He got a new job. He needed to be retrained on how to get to his new job. Well, guess what? He got retrained. And he is still working on that, and he is still successfully using the bus to get to and from work every single day. And that is a success story because we've given this person the independence to get to and from the location that he needs to when he needs to, without the 30-minute windows of paratransit service or making reservations one day in advance. Because sometimes you're picking up a shift and they may call you that day to come in and you can't use paratransit. So this enabled this customer to have that empowerment to get to where he needs to go. Now we have also a student, a high school student, and he went to Phoenix Union High School, and he was part of a vocational program at the school. And he needed to learn how to ride the bus to and from school. He struggled, and it took quite a bit of time. It took more than the average number of sessions, which is 3, to graduate, but he did. And he was able to get to and from school. Now, here's the best part. That was a good story, that Tim getting to and from school. The teacher reached out to us 2 years later. This student is now learned how to do his own trip planning and created a trip to get to his job. And he's now been working at his Little Caesars for over 2 years using the bus. That the vocational program enabled him to keep that job, learn how to do the job. And now he has the transportation to get to and from his job every single day. His teacher told us that when he graduated from travel training, his outlook on life completely changed. He was a different person, and he became one of the hardest working students she had, because this student now had goals and now had places to be. We all have places to be, but so did this student now. And his success continued with that. So we really do encourage anybody that wants to use our system to try travel training. If you have a disability and you're a little nervous about getting on the bus or anything like that, that's why we have travel trainers, and especially seniors as well. I know the bus can be a little daunting, but that's what our travel trainers are here for, to prepare you and to get you ready, and then to actually try the travel training program. So that's our travel training program in a nutshell. I would like to, next slide, please. Something else that's really pretty amazing right now is our quality of life. Our quality of life study that we just completed. It is a web page. It is valleymetro.life. I'll put that in the chat. So this website is kind of showing all the impacts that our transit system has done across Maricopa County. It's showing how public transit in the Metro Phoenix interacts with daily life and the value it brings to local communities and the region. It has anticipated results, and they have an increased understanding of how transit investments are critical to the community. So it's showing how the economy has grown around where transit investments have been done. It also demonstrates how continued investments is crucial for Maricopa County, and of course we all know, mainly because it's one of the fastest growing regions in the country. So I really do invite you to kind of take a look at this website. It is interactive. It has a lot of interesting facts that you would be very interested in. And the study did take quite a while, and we've had a lot of things happen within the last 5 to 10 years. So you can really see the impact if we start from the beginning to where we are today with the impacts of transit. Next slide, please. October travel proposed service changes are coming up. So the first changes we have are in Avondale. The Avondale Zoom is being eliminated in the northeast section. It is also eliminating service in Goodyear and Tolleson. The fare is also changing from 50 cents to being free. Avondale Microtransit is going to have an area where they're going to take over that area that is no longer going to have service with the Zoom. So there's going to be a microtransit there. And the fare is expected to be $2 a trip, so each way. I don't have any details on the microtransit project yet, but that is what one of the proposed changes are happening in the Avondale area with the Zoom. Next slide, please. Here you can see the area that is being changed. So all of that purple area is the area that's going to be taken out. So it's only going to be the green area after that. All right, next slide, please. The proposed changes in Chandler, they are increasing their peak frequency to 15 minutes on Route 156. They're also eliminating the service south of Pecos Road on Route 96. and they are eliminating all stops in Mesa and streamlining the route to the freeway on the Route 451. Next slide, please. Here you can see the Dobson proposed reduction route. Next slide, please. And this is the Chandler Flex, which is similar to microtransit. The fare is going to be free initially. The hours of operations are going to be between 6 a.m. and 9 p.m. Monday through Friday, and Saturdays from 7 a.m. to 8 p.m. There will be no service on Sundays. But as you can see, it is in an enclosed area. So that's the only area that this service is going to be available in. Next slide, please. Proposed changes in Mesa. On Route 451, they're going to eliminate all the stops in Mesa to streamline this route to the freeway, like we mentioned a little bit before. On Route 531, they're eliminating one of the morning trips and one of the afternoon trips on their express route. On Route 535, they're also eliminating one morning and one afternoon trip on that express route. And on Route 533, they're eliminating 2 mornings and 2 afternoon trips on that express route. Next slide, please. Here's the proposed trip or route reduction on the Route 451. Next slide, please. The proposed changes in Mesa. Additionally, the Mesa Fiesta Bus is a new circulator serving the Fiesta district in Mesa. So that's going to be fun. We also have Route 77. It's going to be extended to the West Mesa Park and Ride. And Route 30 in Mesa, they're going to have improved frequency on Saturdays, and they're adding Sunday service to match Tempe. So some areas of Mesa did not have paratransit service on Sundays. Because of that, now they will be having that as well. Because always remember that the changes that happen in fixed route happen with paratransit / dial-up. Next service, please. Next slide, please. Sorry. Here is the proposed route for the Mesa Fiesta Bus. Next slide, please. And the proposed extension on Route 77. Next slide, please. Additional proposed changes on Route 106 on Peoria Avenue. They're extending Sunday service to 99th Avenue. The Orbit Saturn, they are going to have one additional round trip on the weekday mornings to extend the service span. And then Route 43 on 43rd Avenue, they're extending the route to Lower Buckeye. Next slide, please. Here you can see the route extension on Route 43 on 43rd Avenue. Next slide, please. Now for some paratransit effects because of the changes. So the new free zone in Mesa and Avondale covering the service of the new Fiesta Bus, that's going to be a Zoom service. And and the Zoom service, that's also going to be free for paratransit if you travel within that area. So if you travel within a quarter mile of those bus routes, it'll be a free service. Also, there is an additional service area near Mesa on Route 77 and Baseline, where there will be more service as well because the service is increasing. And then the new microtransit zones in Chandler and Avondale as well, and the new flexible transit partnership with Tolleson and Uber and Lyft, they're going to also help supplement ADA service. So the microtransit is going to be a service that's only available in an enclosed area. You would call, and it's a demand service that would be curb to curb. The flex service is similar. The Uber and Lyft service with Tolleson is a city-run operation that they are negotiating with Uber and Lyft in regards to that. So I don't have too much information on that. And it's going to be only locally in Tolleson, and then a few of main areas in Avondale, such as the popular Walmart or the college. Next slide, please. Now, there is going to be a related service reduction over 25% because of COVID. And these are the areas that the revenue versus the reduction percentage has been. So as you can see, the COVID-related service reductions for Express and Rapids has been very, very high. And so because they are a more costly service, they are reducing this because the ridership just is not there. Next slide, please. And here are some circulators that are also been reduced as well. As you can see, the trolley in Scottsdale, their service has been suspended completely on the weekends. Next slide, please. Yes. So here we have an area that you can go and share your feedback, such as, you can do input@valleymetro.org. So if you have any questions, concerns, or don't like what's happening or love what's happening, we'd love to hear your feedback. And this is where you could do it. If you have ideas as well, anything that's happening, we'd love to hear that as well. This is the public hearing. You could also put a comment on that. You could leave a verbal comment on our voicemail, and it will count as a formal comment in our public hearing as well. Or you can call our customer service at any time and give us customer feedback on any of these changes that are happening. Next slide, please. Project overviews. Next slide, please. So the Northwest Extension Phase 2. I don't know if some of you have seen, there's a little bit of traffic off I-17 close to Metro Center and off Dunlap. The bridge is going over. If you've been out going towards Flagstaff or anything like that, you'll see this huge construction area. The bridge is being built and it has already gone over there. The utility relocation should be completed by the end of this summer. So once they got that going, it's going to really sprout up pretty quickly. Next slide, please. Here you can see this is the first rail that was delivered on April 25th. Next slide, please. And they're laying rail overnight. I feel these guys are just heroes in my book because they work at our cold temperatures in the winter and our extreme temperatures in the summer. And they're out there every single day. So next slide, please. Here you can see a little slab of cement that's completed rail insulation. Next slide, please. Here's the bridge that's going into Metro Center Station. They're starting that already. So this is the only area where the bridge is actually going over the freeway. So that's pretty exciting. Next slide, please. Now the South Central Extension Downtown Hub. I'm sure if you are in downtown or if you work at MAG, you've seen a little bit of construction going on, right? Or at least hear it through your windows. Well, it's still going on. A lot is happening. The construction hub that I'm talking about, though, is a little bit more towards cityscape. They are making sure that they get the downtown hubs ready for the track, and they're installing the station installations are continuously happening in the downtown area, as well as utility relocations along South Central Avenue. Next slide, please. Here you can see one of the locations that has been completely gutted out. There is a lot of construction. Just if you do decide to walk through here, just make sure you keep a wary eye open as to where you are stepping. This is going off on Washington Street. And then the next slide, please. Here you get a little more aerial view of a different section as well, Central Avenue and Washington Street. Next slide, please. And a little more wide panoramic view here. So there's a lot going on in downtown area for sure. Next slide, please. The streetcar is now open, yay! So Tempe streetcar is open. The construction in downtown along Mill is all done for the streetcar. It opened on May 20th, and it is free to board for the first year. It does a loop around Mill and ASU, and it goes all the way out to, I believe it's Danbury Lane, and then it does a loop all the way back. It travels to 14 stops on a 3-mile loop. So go ahead, check it out. It is a green trolley rail vehicle, so it's pretty fun. Next slide, please. There it is. It's so cute. All right, so that's one of our brand new streetcars. This is at the opening when we were celebrating the start of the streetcar. Next slide, please. And this is our leadership and everybody involved with making sure that this happened. So this was a very, very, very hard and very, I guess, satisfying item that we were able to complete. Next slide, please. Our transit book. It's officially digital. There will be no more manual or paper transit books. It's all going to be officially digital. So what do you do if you need a paper copy? Next slide, please. You can use our Valley Metro app instead. You could download it. You could get real-time bus updates. You can see the bus, where it's coming, what time it's going to be coming, and you can plan your trips there. Right now, we've had over 99,000 downloads since June of 2022. And around December, in the wintertime, we're going to be having mobile fare payment options. So you'll be able to pay with your mobile phone. Next slide, please. Maybe you still don't want to do that because you just don't like to use your cell phone. Well, we have all our routes available on the webpage where you can print out your specific route and time, as well as printed brochures. But we also have our customer service where you can call our customer service line and somebody there can assist you and even mail you the appropriate route that you need or are requesting about, and the appropriate times that you're looking at. So if you still do need a paper copy, you can call our customer service at 602-253-5000, and then you can request a copy of the route you're looking for. Next slide, please. Valley Metro Accessibility Advisory Group. We are encouraging everybody to look into this. Next slide, please. Who is it for and who can join? Well, anybody that lives here in the Metro Phoenix area, Maricopa resident, can join. You have to be a senior 65 and older, a person with a disability, or you care for a senior or a person with disability, or you are an employee of a volunteer or organization which serves seniors and people with disabilities. I'm pretty sure there's a few of you on here right now. But I wanted to tell you that this is a great opportunity to not only learn what projects are going on, but learn about the accessibility of our service. You may see Valley Metro and you may see our buses and they may be daunting to you, or they may be just not an option, you think, but you'd be very surprised. Every one of our buses is 100% accessible. Every one of our rails and trains are 100% accessible. All of our paratransit vehicles are 100% accessible. And we strive to continue that accessibility, but sometimes we are too close to the actual project or the actual service, and we miss something. And that's where VMAG is vital. We always encourage, we always have it open, and we have VMAG is only a meeting once every other month. And we encourage you to tell us what you want to learn about us and what accessibility factors in transit you want to learn. Recently, we did a presentation on tactical pavers. Tactical pavers are the little bumps that you see that are on the bottom of train stations or rails or even crosswalks. Tactical pavers, there's so much engineering that goes into that. You'd be very surprised. Yet sometimes we get it wrong because frankly, we don't use them. We put them for people that use them. So having a different insight can sometimes help us. One example that one person gave us was we were making a structure and it didn't allow for people that had those high-end vans that are accessible vans to get into the garage structured area. And they needed to start over because they were accessible. So these are things that can happen, things that we may overlook. And that's why VMAG is very important. It is part of all modes of transportation, so not just paratransit. It is paratransit, ride choice, our regular bus routes, our express bus routes, our trolleys, our trains, as well as our circulators. So if you take the bus, know about taking the bus, customers take the bus, customers want to take the bus, and you want to know about the accessibilities of our various projects, including webpage, our apps, and also our services as well. Please take some time and look into our webpage and see if VMAG is something that you'd be considered to join. Next slide, please. So how to apply, since I've already convinced all of you? Well, it's valleymetro.org/accessibility/advisory group. You could fill out the application online, and then we'll gather them. We'll do an interview. And then one thing that we do need to take into consideration is we can't have everybody from the same city. So we do need to have a holistic opinion. So we need to have people from Mesa, from Gilbert, from Northern Phoenix, from Southern Phoenix, from Peoria. So we need to have them all over the place. So if somebody is already in an area that somebody's already a member in the area that you are, you may not be selected because of that. Doesn't mean that you're not a potential candidate in the future. But these meetings are also public and they're open for anybody to attend. And they happen on the last Thursday of the month, every other month. Our next meeting would be happening in August. Next slide, please. So if you don't have any questions, or if you have any questions, I'm here to open or answer any questions for you. If not, thank you very much.
If you have any questions, feel free to raise your hand or put it into the chat. If you think of it afterwards, feel free to email it to myself or Ezequias, and we can get that to Guillermo. I just would like to thank Guillermo for this update. Public transit and Valley Metro has been a great partner in our TAP program. And public transportation, if it's available and it's appropriate, is a great resource for your consumers if they're able to take advantage of it. Our public transit has a schedule, as Guillermo stated, it has a standard schedule, and they can tell you what time it runs. I'm really happy to see the light rail expanding. I've gotten a couple of comments from consumers who are so thankful for light rail. One in particular said, who uses a accessibility device, a wheelchair, who said she moved in an area specifically to be able to use light rail because she said it's accessible for her. It gives her independence because she can get on and off herself, and it takes her to the places that she wants to go. But I'm so happy to see the extension of the light rail to give other individuals an opportunity to take advantage of this travel mode. Again, public transit is a great resource if it's available in your area. And I'm really happy to see all the resources that you provide individuals, not only in utilizing public transit, but also how to provide input as a consumer into your services. So I see people saying thank you for the information, Guillermo. Again, if you have any questions, feel free to put in your chat, to raise your hands, or if you want to send it as an email to us, and we can give that to Guillermo. Thank you for that information. We greatly appreciate
Thank
it.
you.
Okay. Before we head on to our next agenda item, we have another polling question. That is, are you a Section 5310 subrecipient representative today? Yes, no. And I added another answer as no, but I would like more information. And okay, I think the points, we've got 85 participated in our polling question. So 81% of you are subrecipients, and thank you for attending and participating in our chat meeting today. We have about 14% not a subrecipient, so welcome to our coordination meetings. Definitely want to provide everybody information that they can take back, whether a subrecipient or not. It is a great opportunity that you know what organizations are available and out here in our region. And then we have, I'm not sure, but I'm sitting in for our CEO. That's awesome. And then we have a couple of people who are saying they're not subrecipients, but would like more information. Definitely, thank you for attending. If you do have any questions after this program, feel free to email Ezekias or myself, and we can follow up with you and provide you more information about our program. Definitely, that is open to any agency. So thank you. I would now like to introduce our next presenter. Thank you, Ezekias. Ezekias has put his email into the chat. I would like to introduce our next presenter, Stephanie Ringel. She is the budget analyst for the City of Phoenix, who is our designated recipient for the 5310 program. She's with the City of Phoenix Public Transit Department, and Stephanie will provide updates from the City of Phoenix. So Stephanie.
Good afternoon. Can everyone hear me?
Yes.
Okay, I'm sorry, I don't have a camera, so you'll just have to listen to me. First of all, welcome all to the meeting. This is my first time attending on behalf of Wendy. Just to give you a little background, once you apply for your project in the competitive process, I take whatever is awarded, and I myself and a couple other staff members, we submit the grant application to FTA and get it all awarded so that you can get your vehicles and your operating assistance and preventive maintenance. So just a quick little thing. A couple quick things I wanted to say. I believe a lot you were all aware that the City of Phoenix went through a triennial review by the FTA this last week, and the site visit is completed. Everything came out good. There will be a few little changes for as far as the grant agreements that we send out, but otherwise everything was great. There were no findings on any of the questions regarding 5310, the 5310 program. They complimented us on how the program is operated between Phoenix and MAG and so forth. And they said it was very well oiled is what they said. Wendy wanted to especially thank the three subrecipients, Civitan, Valley Life, and Hacienda, that sat in on, I think, one or two of the meetings. I'm not quite sure, but we appreciate all your support in doing that for us. Another quick thing is I will be working on the grant, so we're hoping to get that going, and then we'll get the agreements out in the coming months for everyone that was awarded, notified of awarding for this last process. And I think that's about it. If there are any questions, you can contact Wendy or Dee Dee or Hezekias at MAG, and then they'll funnel the questions onto us. So if there's nothing else, thank you very much.
Thank you, Stephanie. And I would just like to thank you, the City of Phoenix staff, and Wendy for being such a great partner. We could not get this done without your support. And I do see some thank yous from sub-recipients in the chat. We are taking the priority listing for this year for the Section 5310 application process to the MAG Regional Council for approval to forward to the City of Phoenix to develop the consolidated application process. I just wanted to add this year, the 5310 program is under a new legislative act called, I think, the Investment, Infrastructure, and Jobs Act. And we did see an increase. And it was under the old FAST Act, it's under this new IIJA Act. We did see quite a bit of increase at, I believe it's 5.1 million.
Correct.
Okay.
Correct. Yeah.
So I just want to let everybody know that we received quite a jump in the apportionment that we got for our region. We'll be working with the City of Phoenix once again in developing the application process and coordinating that for 2023. So I just wanted to let everyone put it on your radar, especially for those agencies that are not subrecipients but would be interested in learning more about 5310. Please feel free to email Ezekias for more information on that. And if you have any questions for Stephanie, you can definitely email that to us or to Stephanie. And it's great that the City of Phoenix did develop an email box specifically for this. And I believe it's section 5310 at phoenix.gov.
That is correct.
Yeah, so thank you so much for putting that resource out to our subrecipients to make it flow a little bit easier. And all of the emails that go into the to that email box, staff will take a look at it to see who is the most appropriate person to reply to that, and they will get back with you. So definitely we are so thankful for the City of Phoenix to bring such a great supporter of this program and a great partner for human services transportation.
Thank you.
Okay, thank you. And you did a great job, Stephanie. I would now like to head on to our next presenter and our next agenda item. And I just realized I was talking with my daughter yesterday, and we're just talking about how long we've been in this kind of situation. And I just realized we had our first virtual TAP meeting 3 years ago. So we definitely want to make sure that we are providing you with the most recent updates regarding COVID-19 to ensure that you, your staff, and the consumers that you serve have the most up-to-date information. And we are so grateful that Lori has been with us from the beginning and providing us information and updates during this time. And we are grateful that you are providing these updates so that we get the most current and correct information. So I'd now like to introduce Lori Thomas, who is the Manager of Healthy Aging, to provide information updates from the Maricopa Department of Public Health. Thank you, Lori. I think you're on mute.
Thank you so much for allowing me to come and share this time with you. The updates are less than sometimes they are. So hopefully we're managing this better. Next slide. Two things I want to talk about today, the COVID prevalence for this time period and the new vaccine that's available for children 6 months to 4 years. And so let's go to the next slide. Our community transmission right now, we have a case rate of 239 people per 100,000 people. And the percent positivity is 25%. And so of those people tested, 25% have come up positive. And that puts us in a moderate level. And we have been in a low level. And so we have seen an increase in the number of people that have tested positive for COVID. We have not seen the hospitalization or death rate that we have seen in times past. Next slide. As you can see, the curve here, starting out, those are lots of dates to look at. But as you can see, the curve, we had such a high curve, and then it went down. And then as you can see up to date, we have seen an increase in the last few months, but it has been a slow curve. This is the Omicron variant. And even though it has spread more easily, it has had less hospitalizations and less death. One thing that I do want to be clear about is that there are people that are still passing away from COVID, and the people that are vaccinated are have a lower rate of severe illness and death than those that are unvaccinated. So it is still important and urgent to get vaccinated. Next. Okay, the big news for this week is that the U.S. Food and Drug Administration gave emergency use authorization on Friday of last week for both Pfizer and Moderna vaccines for young children. And so the advisors voted unanimously on Saturday to support giving young children 6 months old to 4 years old these COVID vaccines. So many people have been waiting for this. Arizona's youngest children's net can now benefit from COVID vaccinations. These vaccinations are available at your healthcare provider, at FQHCs, the federally qualified health centers, and also at pharmacies. So please feel free to go to the cdc.org and look up and get more information to see if you feel comfortable having your children or grandchildren immunized, and the information will be there. The Arizona Department of Health Services is encouraging parents and grandparents to do that. It looks like we have about 400,000 children that are eligible in the state of Arizona. As you know, children are very effective spreaders of disease. So having eligible family members vaccinated helps reduce the risk to others, including older relatives and others with weaker immune systems. So just that's what you need to know. We've ordered about 60,000 doses as of yesterday. There will be more that are coming, but that should do us for a few days and maybe a week or so. So just to let you know that retail pharmacies are able to vaccinate ages 3 and older. They are not going to be doing the children from 6 months to 3 years. So just wanted to make you aware of that. That would need to be done at your pediatrician or FP or your other kind of healthcare provider. But those did start yesterday. And so for those wanting those and those that those appointments did fill up really fast yesterday for those parents that have been waiting for that. So I'd be happy to take any questions. I am not a physician, but if I can answer them, I will. And if not, I can find out the answers for you. So we thank you for your time over this long extended time and helping get the word out about vaccinations. Next slide. Basically what you need to know is that the CDC recommends everyone age 6 and older get vaccinated, and the Pfizer vaccine is 3 doses and the Moderna is 2 doses. So contact your healthcare provider and if you're interested in having your children vaccinated. So thank you very much. And are there any questions?
Yes, are there any questions for Lori? There's one in the chat. It said we had,
Go ahead.
okay, we had quite a spike with positive tests. Looks like head cold, but not.
That's true. A lot of people in the recent times, you saw that spike that was going up. They have tested positive for COVID, and some of the symptoms were no more than a head cold and a sore throat. And part of the reason for that is that some people have an immunity, and some people from the immunization that they received, 2 doses and a booster or whatever they received. And some people also have an immunization from actually having had COVID prior. So if they indeed got it again, if their immunization had waned, they had fewer symptoms and it seemed much less virile than it had been before. But you are correct. The symptoms for many seemed much less than before.
And I have a question too. Just a comment. I did recently see that Dr. Fauci tested positive. Do we know of his symptoms and
You know, he had tested positive once before, early on. So I don't really know. I don't really think his symptoms were terribly severe this time. I don't know. He seems to still be doing a lot of interviews, so I don't know what his symptoms were. I don't know that they released that. So, that I just don't know. But people are testing positive and having COVID more than once. And sometimes it's a different strain. Sometimes it was a different strain in the beginning than it is this time with the Omni variant.
Also, is it still contagious through though? And we have to be cautious and treat like COVID.
We do still have to be cautious. As you know, school is starting up again, and children are great spreaders of this. And because many people are not wearing masks anymore, and we have lost our hand washing fastidiousness that we once had. Airlines are not requiring masks. We don't see that in a lot of our areas where we have high concentration of people. So we are going to continue to see COVID, and we will continue to see perhaps different strains and variants of COVID. So all of those things that we've done to mitigate symptoms, to mitigate the spread, we need to continue to be cautious about, especially for those people that are of high risk, especially for those people that become of high risk, that have bronchitis, and for those people that go into fall and have, flu season. So we're encouraging people to get their flu shots. And so that they are, and if they are, if they are exposed to COVID, that they are not going to be more. So we appreciate everyone's help, but we still need to be vigilant. There will be another strain. I think everyone has done a really good job in helping with this, but there will be another strain of some sort. Maybe we've learned lots of good things, but I know that we are less vigilant than we have been with hand washing and with masking. But we do have good news. The people that have COVID are not filling up the ICU beds, not using ventilators, and all of that we saw for such a heavy amount of time. Something that is not a particularly great number, but I saw in the New York Times today, is that they are quoting that 338 people still die every day from COVID. So, it still is it still is happening, and people still are dying from this, disease.
Thank you for your comments, and thank you for the reminder of being vigilant. And I'm just wondering, because some people are experiencing like head cold symptoms. Do you think the reporting or being tested for COVID may 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 influence the data?
Well, it's interesting because the home tests are much more available now than they've ever been before. But
That's true.
99% of people that take home tests don't report those to an ACEs or a reporting agency or their family practitioner. So it's probably underreported the amount of people that actually have COVID. So unless you've gone to a facility that reports that to the state, it's probably underreported.
Thank you. Does anybody else have any comments or questions for Lori while we have her? And again, I greatly appreciate you being with us from the beginning, from our first virtual meeting 3 years ago.
Well, you are so welcome, and you've been so kind. I just want to give you kind of a high level view, and there is good news. But as with all things, we have to stay vigilant. So thank everyone for all of their help in spreading the word. So thank you for allowing me to come and give updates with information that the health department thinks are accurate and helpful.
Thank you. Oh, I just wanted to share this. I think this is, I have the same feelings too. This is from Billy Parker from Charlie Gilbert Arc, who says, Lori, has always, thanks so much for your updates and also being part of the TAP group. And I also agree with that. Greatly appreciate your updates, sharing of the data. So many of us are service providers.
Absolutely. This is just a great group to get any kind of information out to that you would like to have spread. So thank you.
Okay, thank you. And as always, if you have any if you have any questions for Lori, feel free to either email Lori or Eskis and I, and we can get that to her if you think of something afterwards. Okay, and then we just had a comment from Yael Younger, who said, my 3-year-old niece just got her vaccine due to the approval, so yay. So that's great news, and I'm glad that your niece is protected.
Good. Well, thank you for your time.
Thank you so much for being with us.
Uh-huh.
Have a great day. Now on to our next agenda item. We want to take a moment to do an agency spotlight to share the great work that you are doing for our community. And today we have with us the Scottsdale Training and Rehabilitation Services. A lot of us know it has stars who will provide an overview of their organization. So Tom, if you're available, I will hand this over to you.
Thank you very much. It's my pleasure and honor to be here. STARS Employment Services, we have about 4 different employment services, everything from competitive and integrated employment, community support employment, which is ISE ESA. We just started our group supported employment, which is GSC, and our center-based employment, which is CBE, our work center. Next slide, please. So that's me. I'm older, bald guy. You guys were doing introductions earlier, and you talked about long hair, short hair. Well, I got bald hair. So it's nice to meet you guys. I've been at STARS for 8 years. I've had 35 years experience working in special ed, social work, and others. Next slide, please. Our CBE, our center-based employment, is great for persons with disabilities that are looking to gain vocational skills but they're not really ready yet for jobs in the community. The work center is a great place to start. A lot of times they're either transitioning out of high schools, or maybe they're just not ready yet socially, or as far as their job skills go. We have, and it's a regular job. They get paid a piece rate. They come into work and they learn their job skills. Next slide, please. I just started our group support in employment. We had to close that down in the beginning of COVID. We had over 30 participants in our Enclave program. They were basically a group of individuals that are in a segregated group that would go ahead and work at Fry's, Honor Health, Chick-fil-A, and all that. One of the issues we had was that they weren't getting hired on. So when COVID hit, we had to go ahead and close them all down. And then I'll talk about my next program, how we started that. But with the group supported employment, Phoenix Convention Center loved it and really enjoyed it. So I kind of tweaked the way we did it. And so now we're going to be back at the Phoenix Convention Center soon, which is great. They learn the skills that you would in the work center, but it is out in the community, but in a group, and they go ahead and feel part of that employer where they're working. They get to have a chance to go ahead and walk, ride paratransit to work. So we do have that. And they go ahead and get that experience. So when Adventura, the catering company, sees how well they're doing, then they can get hired. Next slide, please. And then we are at the reasons for the competitive and integrated employment. It was previous called Employment First, which is a model that we're using, that a lot of states are using. We have piloted this program with vocational rehabilitation. And so we're the first agency to go ahead and do it this way. We have, there's so many great other agencies doing vocational programs. But this model is a little more specific to the needs and the long needs of our participants and our job seekers, as far as from the beginning of wanting to go ahead and get a job. So we're doing those vocational skills, learning how to do interviews, we do mock interviews, resume building, doing application processes. Some of our people with disabilities can't read or write, so we have a one-on-one staff that does that. Once they are hired, which we believe that everybody is hireable, no matter the reasons why or about their disability. So they are hireable and able to go ahead and be able to work. Maybe we need to customize or carve out a position there. We could read a jobs description and say, you know what, they can only do this much. And we talk to the HR people there. How can we accommodate our person with a disability to work over at with you? And so basically, we've had great success with that. We've had 70 people since March of 2020 be in our program since COVID hit. And we've had over 40 people that have been hired. So it's really successful. I'm hiring new staff for that. And so these are kind of the integration of how these programs work from our CBE, our GSC, and now competitive integrated employment. So you could go to the next slide, please. And so basically, what is competitive integrated employment? It's basically the majority of the employees are not diagnosed as having disability. The person has the opportunity to interact frequently with employers without disabilities. The person receives a direct payment from the employer. They are directly hired on with the employer. The person is paid comparably to the peers without disabilities, either at or above minimum wage. Basically, our person with a disability is going to go ahead and be hired on by the work. They get treated like anybody else, and they would have a job coach or an employment specialist with the individual during that time to go ahead and train them to be successful, get those natural supports, and also be, working independently. Next slide, please. So there are 4 phases of competitive and integrated employment. Number 1 is discovery. We go ahead and find out about them. We've developed a workbook to go ahead and find out their likes, their dislikes, what kind of chores they like to do, what were they successful at in school or other work, and find that out and get to know them, show them the rapport. And then go through the resume building and mock interviews, elevator speeches and everything. Then we go to on-site training, and then we do a fading and closure of VR services. Then we transition to STARS. Another program that STARS has is ISE ESA, which is basically community employment support, where we go ahead and they fade out of my other program and go into our ISE and ESA, and they have maybe 1 hour a week or 1 hour a month where our job coach would go ahead and meet with them instead of having them every hour of every day. So we call that successful. These are my wonderful job placement coordinators, our employment specialists that get those individuals ready for their next phase. Next slide, please. So of course, you guys could have a copy of this PowerPoint. I'm just kind of skimming it over due to the respecting everybody's time and everything. One of our success stories, Jackson, he came to us, he had a difficult time finding work or holding work with more than 6 months to a year. We're able to find him a job at U-Haul. His champion, I like to call her, is Marcia. She's the manager over there. She was able to go ahead and learn from our job placement coordinators or job coaches and be educated and open to go ahead and be able to work with our individuals with disabilities. Jackson's been there over a year, doing great. And I can't get thank Marcia enough and U-Haul. They've hired another person with disabilities from STARS, and they can't get enough of us. So it's a pleasure to have them. Next slide, please. So basically, there's a video there, and after I talk about Brian for a second, then we'll click on the video and hear the testimony of his sister. Basically, Brian's working at LGO, La Grande Orange, and he was working at the one over there by the Biltmore, and now he's working at the one that's now at the airport. He's autistic. He has trouble socializing, and when I first met him, was in the group support employment, and I did case management, basically yes or no questions. We had a job fair at La Grande Orange, and I had a bunch of people go ahead and sign up for this job fair, and Brian was supposed to be first at 10 o'clock. And, me and this other guy was there, and we're having all these participants there, wondering where he is. I'm calling his phone, I'm calling his sister and everything like that. And we see the lady that I've been dealing with come out with this individual, hair combed, sharply dressed, shaved, looking great. I thought he was the general manager. It was Brian. Brian was there. He did the interview by himself because he was taught and trained in the ability of doing that, got hired right on the spot. Then after our Employment First or our CIE program, then we go to the community-based support employment. And basically, like I said before, these job coaches will see them once a week for an hour, and they're successful. But that ensures that the support that STARS is always going to be there for these individuals, whether they need a little bit of support or more. So they could be successful, they could be self-sufficient, we could empower them and continue to live in an integrated world and be successful. Next slide, please. This is another success story. Ava over to the left. She wanted to go ahead and work in a bakery. Well, LeGrand Orange was looking. So we were able to go ahead and she tried out. She went on a work and interview. Guess what? They hired her on the spot. She's still over a year working there, making these wonderful red velvet cupcakes. I'm telling you, you want to get some dessert there, good stuff. And then we have Brian in the middle, and then Brian to the right, a different Brian, which mom never thought that she would see him working independently other than working in a group supported employment. Now he's taken his own paratransit by himself, which mom thought that wouldn't be successful. He's doing that. He's able to get to work every day. And then the next slide, please. And these are some of our success stories, and everywhere from Saguaro to our work center to Cox Communication to Fry's to canteen to everywhere. It doesn't matter. They don't have to be forced to be working in one place. It's up to them where they want to work, and it's up to our community to go ahead and hire our participants, our people with disabilities in our community. So I know I don't have information as far as my name and email and phone number. I will put that in the chat. I want to go ahead and thank everybody for your time. I really appreciate it. I know we have Jackie Walker here that's from STARS DTA and talk about the other programs over there that we have to offer. So thank you very much.
Thank you, Tom. And Jackie?
Yes, hi, hello, everyone. Thank you so much for having me and Tom and STARS. My name is Jackie. I am the day training for adults program manager here with STARS. I guess next slide, please, because my PowerPoint is not as fulfilled as Tom here, as over at Osborne. He oversees many different employment services right now. I am overseeing just our day training, which is equally as important. You know, we have a lot of families who just want their member to be really just taken care of and endure those life skills, those social skills, being around peers and just seeing like just interaction with other people, and that's just equally as important. I'm reading that you don't have my PowerPoint presentation. So I guess my presentation won't be as interactive as I would like it to be, because I did share some really cool pictures of just, our program in action. But here at STARS, it's at our Choya campus. It's a huge campus. It was previously a school, so you can imagine how large it is. It's open. We have multiple different classrooms. We have a common area. We have a full garden outside with different greenhouses, which allows us to properly maintain and grow and maintain different produce and plants and flowers, herbs. But our program, we go over daily life skill training, social skill training, functional skill training. As you all know, we promote a lot of independence here. Anything our members can do, they should do. And we, our DSPs, we work really hard to make sure that they are fulfilling those different independencies. We also do language skill training here. Some of our members, they use sign language. We have people that speak Spanish. So daily we go over different sign language tools. We learn new terms in Spanish just so we could all interact with one another. We have smart boards installed in each of our classrooms, which kind of allows a more hands-on engagement with our lesson plans. Specifically, this was a huge help and benefit from the beginning, coming back from the pandemic, where we kind of wanted to eliminate touching items like pens, papers. We weren't, going out in the community. We had put a hold on vendors and outside resources like our personal trainers, our music and art instructors coming. So the smart boards really allowed our members to kind of, we moved everything to a digital curriculum, and it kind of allowed our members to really engage with that, as well as virtual exploring. We were able to really utilize the internet, finding live workout videos where we were able to participate and still get our workout in, doing our karaoke, our Zumba, Just Dance, watching DIY projects, getting into some of those TikTok challenges that my group really enjoys doing, as well as virtual exploring. We were able to really explore the world. The internet has so many different things to offer, and with these beautiful smart boards that have this incredible imagery, we were able to go to different countries and look at the scenery and museums all over the world, and just learn about it, and listen to it. And the members, they really took that on. In our common area, we have different sections. We have a fitness section. We have a media area. We also have just a relaxation area with different couches, books and magazines, and recreational games like a basketball machine that you would find at a Dave and Buster's. We have a foosball table, ping pong. It allows our members to kind of pick and choose what they want to do. It gives them lots of options, engage with one another, engage with our staff members, as well as having parties. We love to party over here. Our members, they love to get in that kitchen and cook lunch for everybody. We actually have a 4th of July party coming up, and they were all excited to put hot dogs on that menu and get some apple pies and just be in the common area with music and different activities. We always have a photo booth. We have our chocolate machine, which the participants love to get messy in, and it's just a really neat place for everyone to just come together and be themselves and engage with one another, make friends and connections. I say that when you walk through these doors, it's our members' worlds and we're just living in it. STARS is the best part of their day, and it's our job to assure that that is fulfilled. And we look past the whole making sure needs are being met. Sometimes we get caught up, we're changing, we're feeding, we're, distributing medication, we're going over goals, but but it's way more than that. It's social interaction. It's meeting new people. It's expressing yourselves. A lot of our members, they don't have that opportunity. They don't have, what we kind of just overlook sometimes. We don't even realize when we're making new friends, or when we're out on the weekends with our, families, or, peers, and just, having a drink and having a laugh. And some of our members don't really get that opportunity. But here at STARS, we absolutely make sure that they do get that opportunity. I call them members, just like I call staff members. We're all just members here, and we're one big community. So yeah, I'm so sorry that my PowerPoint wasn't sent over to you. I wish I could have shared some of our wonderful pictures and give a little bit more information. I will put my email address in the comment box if anyone is interested in reaching out, want a tour of our beautiful facility, or know someone in the area that is looking for a day training for adults program. Thank you.
Thank you, Tom and Jackie. Thank you, Tom, for that great information regarding your employment services and the competitive integrated employment. I'm really encouraged to see that they are emphasizing competitive wages, which is something that should be common throughout all the programs, and having competitive wages. So that's really really good to hear that that is the emphasis in the competitive integrated employment. And Jackie, your utilization of smart boards, I would like to take a tour and learn more on how you're utilizing those smart boards in your programs.
Yes, absolutely. You are more than welcome.
Definitely, thank you. I think that's really interesting. And this agenda item is a standard. This is a permanent agenda item on all of our TAP meetings. This is just an opportunity for your agent, for us to highlight the great work that your agencies are doing, and just highlighting some of the great programs, and sharing that information with others that they may be interested or may want to have more information on. Definitely, if you have any questions for Tom or Jackie, if you think of it later, you can email it to us and we can contact them. They also put in their email in the chat for you. Definitely, thank you so much. Everybody that I have been in contact through this program are so proud of the work that you do, and you guys are hard workers. Tom said if anyone would like any information on STARS, please reach out or come for a tour. Thank you so much for offering that for our participants here today. And also, if you would like to highlight any success stories of your staff or your members, we have our TAP newsletter. We are always looking for articles. We want to share success stories. Tom did a great job in sharing these great stories. And Jackie, Guillermo shared, a couple of great stories of the consumers he had worked with this training program. We would love to highlight these stories in our TAP newsletter. So if you have any stories, please share this with myself or with Zacchaeus. His email is in the chat. So thank you, STARS. We are always looking for volunteers to present their agency at our TAP meetings. So if you would like to volunteer to present your agency and the great work that you're doing, please contact SKS and I, and we can get you on the agenda. So thank you so much for your time, Tom and Jackie. The next agenda item is the Regional Human Services Transportation Updates. And I just have two items that I wanted to cover of some topics that we are looking on. And thank you, Tom, for letting us share your PowerPoint. Before we begin, I have a polling questions. And my polling question is, have you had cattle converters stolen from your agency? I'll give you a couple of seconds to fill that out. Okay. We're about 70%. Just a couple more seconds for those who would like to. It's at 80%. So it seems about 50% of you have had that unfortunate event of having your catalytic converter stolen from your vans. 37% haven't experienced that. Great work. I hope you're using some techniques that we provided, and about 7% are unsure. And so a follow-up to that question we would like to ask is, if you said yes and you had your catalytic converter stolen, who did your agency report it to? Insurance, the police, insurance and police? None, or not sure. I'll give everybody just a couple more seconds. %. Okay. Thank you for those responding. Thank you. Majority of you did do insurance and police. We're so happy. I am so happy to hear that. Some insurance, some police, none did not report it. Unfortunately, we've heard that from quite a few people who have this as their catalytic converter stolen, is they've not reported to anybody and just repaired it, especially those who are not subrecipients. And 20% said not sure. So thank you for responding to that. And this is a topic that we at MAG, along with our sub-region mobility managers, are looking into. This is not only an issue in our region. We're starting to hear it's an issue in other regions statewide. And recently there was a House bill to help with this issue. It was House Bill 2652, which is titled Sales, Acquisition, and Use Cattle Converters. As Kias did a great job in summarizing that. We'll provide that information to you after our TAP meeting. But what it is it's just making it a little bit harder for those who are in possession of stolen catalytic converter to sell those, or to sell those to well, it makes the possession of a catalytic converter by anyone other than a licensed dealers illegal. It makes it easier to charge people who were caught trying to sell catalytic converters, even if the police cannot prove it was stolen. So there's a couple of measures in the House bill that will make it a little bit harder to sell it, to a recycling place. We are still looking at this issues. We want to know what are the next steps that we would like to take. We did a summary of some best practices you could do, such as putting on the cat cages. And thanks to Wendy, those are now, you can apply for preventive maintenance for that. Also, one important thing is putting your VIN number on the cattle converter, so that it makes it harder if it does get stolen for those individuals, to sell that. And maybe it's a deterrent on that. But this is an issue that we're seeing across the state, and we're seeing it national. And that's why we're getting all these House bills and trying to mitigate this from happening. We did have a focus group, I believe last year, pulling in some of you from your agencies to give us, some comments and feedbacks on how, what your experience were and how we can help. So we do have a summary sheet that I believe is on the MAG website. We'll also post up the summary sheet of the House bill to give you a little bit more information. But one of the things that our sub-regional mobility managers did point out is the two things is getting a cat cage and putting your VIN number on it. Another one was saying putting fluorescent paint on your catalytic converter, which will make it obvious that it came from somewhere. But we definitely will be looking at this, and we may be pulling together another focus group to see what our next steps. But one of the most important things that we would like we encourage everybody to do is not only, of course, if you're sub-recipient, reporting it to the city of Phoenix, your insurance, but definitely report it to the police. We need the police to know how prevalent this is, and we need to get the data. You know, we want them to have the data to know that this is happening, this is an occurrence. So we encourage all of you that unfortunately that had this happen, you know, the police report it to the police. So thank you. Then I'd like to bring up another polling question for the next topic that we're working on at Ezekias. My next question is, does your agency currently have any driver vacancies? And I'll give you a couple of seconds to. And I'm surprised that there are some agencies that have no driver vacancies. You have about 76% reporting for those who are okay. So 4% said not sure. 30% of you here today said you do not have any driver vacancy, and that's really good news. And unfortunately, 67% of you here today said yes, you do have some driver vacancies at your agency. And I'd like to pull up the next polling question for those that do have vacancies. If you responded yes, is your agency having difficult filling the vacancies? Is your agency having difficult? Oh, Donna, great. Thank you. Donna said that all of our drivers are volunteers, so technically we don't have vacancies. So do you have any vacancies in volunteers who drive? And then Yale Younger, I just wanted to go back to your comment regarding the cattle converter. Unfortunately, he pulled his vehicle out of storage and had his cattle converter cut out a week later, which is frustrating. So I definitely hope that you did report that. And you can always use more volunteers. Thank you for putting that out there. So anybody online, volunteers are always needed. So 9% are saying they're not sure. 18% said they're not having difficulty filling up the vacancies, but unfortunately 73% are saying yes, we are having difficulty filling up the driver vacancies. And Ezekias and I recently went to the Community Transportation Association of America conference last month, I believe. And this was an issue that was being discussed at the conference. And this is being felt not only statewide, but national. And there are a lot of different issues regarding recruiting and retaining staff. And not only are we seeing difficulties, some vacancies in drivers and staff, we're also seeing vacancies at repair shops they're just not getting enough staff, which kind of then delays if you have to put a vehicle in for repair. And because that repair shop doesn't have enough staff, that delays it further. So we're seeing a large vacancies in a number of wide areas that affects our agencies overall. So this is also another topic that we are looking at on a regional level. Guillermo, thank you. Purchasing the vehicles too. Definitely. I was just on a a national um, meeting last Friday um, for the transit. It's a national transit association, and that is a topic that they are taking up is the procurement of vehicles and trying to get some dialogue around there. So on a regional level, here at MAC and with our sub-region mobility managers, this is something that we're looking at. We understand, the difficulty of recruiting and retaining. We're looking at different resources. Hezekias is, pulling together some information and exploring what resources are out there. We are looking at possibly bringing in a speaker from the Community Transportation Association of America who is working on this also, and bringing that in for you. But I just want to kind of get a temperature of what this is like with you, our participants, and how much of an issue is it. Um, we might, like we did with the cattle converter, we may do a focus group with agencies. So if we do see that email going out, please try to attend because we want to get your feedback. We want to know what the issues are on this. Um, so these are just two of the really kind of pertinent issues and topics that we are working at on a regional level. So I just wanted to give that update. Does anybody have any questions? And I'm glad, Guillermo, that you brought up, the purchasing. That is something that Wendy and her staff at the City of Phoenix are also, looking at. But like I said, the Transit Association are taking top that on that issue on. Okay, that concludes my updates for right now. We're also, continuing to working on next application process. I just wanted to say that for those that have applied for 2020, the priority listing will go before regional council, and we should notify you regarding um, the Section 5310 awards. For our next agenda item, does anybody have any questions? All right. For our next agenda item, I would like to introduce Ezekias Oja, who will introduce our next presenters. Thank you.
Thank you, Didi. Um, Let me just change this over here. All right, thank you, Didi. I do have a polling question before I can go on with my topic. And my polling question is, how are you more likely to attend trainings and workshops that we offer? Hopefully you've been participating in other trainings and workshops that we've had throughout these past couple of years. They have been virtual for the most part. So we just want to know, moving forward with the changes in COVID, some reopenings, and changes on social distancing, how we can plan ahead of time for our upcoming meetings. All right, we have quite a few people responding. I'm going to give just a couple more seconds. All right, thank you for response. It looks like the majority of the people attending here today would like to stay virtual. but we do have about a third, 36% that would like both. That would be able to attend both virtual or in person, and a few people prefer the in person option. We'll keep that in mind for when we are planning our future workshops and trainings. Thank you so much for your feedback on that. And that brings me to talking a little bit about our workshops. We have finished the first half of trainings and workshops for this year. It has been very successful with a lot of good feedback and some suggestions on changes and new topics. So we really appreciate that from everyone who has participated. And we are looking on creating the schedule for the second half of the year, and we'll be publishing all of that on our workshops website. If you don't know where it is located, I'll be sending an email after this meeting with more details on how to access that. The workshops website don't only have the schedule and how to RSVP for our meetings, but it has also the recordings and materials provided in our previous workshops. So if you missed any of our workshops, or you would like to learn a little bit more about the topics that we cover anything from driver safety training, preventive maintenance training, de-escalation tactics, how to deal with COVID, and has Didi just mentioned that we had a meeting just a few weeks ago about how to deal with COVID and hiring process and all of these bigger picture issues. All of these topics and many others are available in our workshops website. So thank you so much for attending these workshops and visiting our website. And with that, I want to also thank our sub-regional mobility managers who have been a key part on providing those workshops and trainings. If you have any questions about these trainings and workshops, how to access all of the material, feel free to email me on the email showing in the screen right now at agerosha@azmag.gov. And talking about our sub-regional mobility managers, I want to pass the baton to them so they can provide a little bit more updates on what they have provided so far on their workshops and um, a little bit more about the subjects that they have covered and the feedback that they have heard and what are the plans. So first I have here Mark Botabash with Gumpers. So Mark.
Hello. As you can see, I'm not Mark. He did have to step away from the meeting. I'm not sure if he had anything planned as far as like PowerPoints or anything. Did he? No. Okay. So I was just asked to kind of sit in and go over some of the trainings that I've done for MAG. So let me start off by saying my name is Heather Peralta. I am the guidance trainer here for Gompers. Professionally, I have been supporting folks who have developmental disabilities now for 21 years. I've worked for Gompers for 17 of those years. For those of you that have not heard of Gompers, we are a facility that is committed to serving adults and children who have developmental disabilities. We provide special education at our Gompers private school. We have 2 DTA programs, which is day training for adults, where we teach things like habilitation goals, life skills, social skills, independence, etc. Gompers also offers job training and employment placement. And I believe right now we are serving more than 350 adults and children who have special needs. Now, as far as what I've done for MAG in the last couple years, I have created and conducted 3 workshops for MAG. The first one was, it was called The Wheels Are Turning, and that was back in November of 2020. This training was designed to discuss minimizing the spread of COVID-19 in the vehicle. Now, that was just based on information that we had at the time. You know, there have been many changes and updates since that training that I did, as Lori spoke on earlier in this meeting today. So that was the first one that I did. And then I believe it was June of 2021, I created a workshop that focused on how to proactively assist individuals who have developmental disabilities and challenging behaviors before they're nearing or in a behavioral emergency. And that was the de-escalation workshop that we did back then. And I believe I think I've done maybe 2 or 3 of the de-escalation workshops for MAG. The most recent workshop that I presented was it was this year in March. I think it was like March 24th or 25th of this year, that discussed transporting passengers with special needs. So I basically give some information on transporting folks who have a diagnosis of epilepsy. We went over cerebral palsy, an introduction on autism, intellectual disability, supporting people who have visual or hearing impairment. So that was the most recent workshop that I've done, and I've only done that one once, but we are working on more of those the second half. Based off the feedback that we received after those workshops, the majority of folks found them, informative and say that they will be, useful for their program. I know that I was reading some of those comments on the feedback sheet, and people were requesting workshops on maintenance and whatnot. But Hezekiah, I just heard you say that you guys do some kind of a training already on maintenance, so that's pretty awesome. The next de-escalation training that will be held via Zoom, we came up with a date of October 27th, and that will be around 10 o'clock. Looks like that one's pretty final, but if anything needs to change, they'll let you know. So that's going to be the transporting passengers with, no, I'm doing the de-escalation training in October, and then we're coming up with a date for the transporting passengers with special needs. So they'll keep you updated on when that will be. So that's a little bit about what I've done and some of the stuff that I've created for MAG. So I appreciate everyone who has attended those. It's been a lot of fun providing you guys with that information. So thank you.
Thank you, Heather, not Mark, for providing this overview of your workshops for Gumpers. Next in here, I had scheduled Justin, but he did have an emergency and was not able to attend today. Justin has been providing the preventive maintenance workshop that Heather mentioned, as well as the driver safety training. Those have been virtual so far, but we have heard some comments requesting in-person trainings for this one. So we're working on that, and we'll keep you updated on how this transition to in-person will work for Justin's trainings. But as of now, we don't have a date scheduled, but as soon as that date is scheduled, I will be sending a notice on our to our mail list. You probably are part of that mail list, but if you are not receiving my emails, feel free to just send me an email requesting to be part of that mail list. Then after Justin, I have here Billy Parker with Chandler Gilbert Arc.
Thanks, Hezekiah, and it's nice to be here and to virtually see everybody. Just a little bit about me. I've been a mobility manager for 8 years. I've been with Chandler Gilbert Arc since 1994, and I've been the executive director here since 2013. We have done through the years a lot of mobility management activities as an organization, and so a lot of the trainings that I provide as a sub-regional mobility manager really have revolved around collaboration in one way or another. I have about 3 different topics that I typically work on in any given year. One is I provide support to recipients in doing grant proposals when the 5310 grants come around. Our agency's been writing grants since I started working here, actually since before I started working here. And so I feel like we have sort of a keen knowledge of the process. And so as a sub-regional mobility manager, that's one thing that I support other organizations with. I have a couple of other trainings that I've done. One is called Let Me Out of This Box. And basically what that really started as is a training that talks about collaboration through vehicle sharing. As the years go by and I do the trainings, I'm modifying them all the time. The last training we did was, excuse me, was on May 24th. And it still talks about vehicle sharing, but it talks about vehicle sharing in a sort of a broader sense. And we really sort of got more into vehicle sharing, the vehicle disposal process. And I know that the city of Phoenix has for the most part, adopted ADOT's process for sharing vehicles. And so a lot of the training that I did really revolved around what vehicle sharing is, why it's important as providers, and really as it relates to the whole collaboration part of mobility management and the 5310 process. And so to me, that all really sort of fits together. I've also worked sort of to a greater level for the last couple of years on the idea of transportation brokerages, and still sort of investigating whether that is a possibility or an option that can be done with other organizations. And an example of that might be a combined shared fleet between organizations, or combined purchase of a vehicle between organizations and a shared use, ride sharing, vehicle sharing, and that sort of thing. And I have always really felt like that's really the true nature of collaboration in our business and within the 5310 process. Then again, as I said, we did kind of a deeper dive into sharing vehicles through vehicle disposals, donating your vehicle to other 5310 recipients, selling your vehicle to other 5310 recipients or individuals, and what that process is. So that's something that will continue. And anybody that's been to my trainings knows that they typically sort of evolve with the times and what is going on, and how organizations are doing. COVID really has had obviously had a big impact on transportation. And so a lot of the discussions we have relate to COVID, what it was like when we were really sort of deeply into COVID and how it impacted transportation. And as we sort of hopefully ease our way out of the COVID pandemic, how transportation picks back up, and whether we can get back into more collaboration. So that's the let me out of this box training. The other training that I have done is called It's a Moving Target. And that was really something that I put together after the pandemic started. And the idea between that, or behind that training, was really just a shared dialogue between organizations in how to manage what is happening at any given time. So I think I've done those trainings probably about 4 times in the last couple of years. And there's always something new going on, depending on, what kind of CDC restrictions there have been with COVID, what kind of issues that anybody's dealing with, closures of organizations, the inability to find staff, how to manage issues relating to COVID and other stakeholder relations, virtual versus in-person services, different things like that. So the last one of those trainings I did was actually not that long ago. It was on June 7th, excuse me. And we really talked about personnel challenges, hiring, recruiting, issues like that, the issues that I know a lot of organizations are dealing with, including Chandler Gilbert Art. So there was a lot of discussion about that, and a lot of discussion about geographic targeting when you're looking at finding employees, a lot of information about messaging and your mission and how that fits in, and what people are really looking for when they're looking for employment, and as an employer when you're looking for employees. So that was really helpful. And anybody that's been to my trainings knows that they're really intended more as an open dialogue and a conversation between organizations and a sharing of ideas. And I think particularly when COVID was really hot, I think a lot of the comments I got from people that attend the trainings was that it was nice to be able to connect with people and realize that we're all dealing with a lot of the same issues and that we have a lot of information to share. And so, and then again, that's collaboration in and of itself, in my opinion. And as far as feedback that I've gotten, a lot of people have been feeling really positive about the trainings that happen. I usually get pretty good interaction and involvement from people that attend the trainings, which is a good thing because I could sit and talk for hours and I'd rather not. I'd rather kind of talk back and forth with people whenever we can. So, and there's been some comments. I know there was one of the trainings and the feedback I got was that people were looking at the possibility of grants, training on doing grants for additional monies or additional funds for organizations or for a number of different topics. And also continued dialogue on collaboration and getting vehicles and transportation resources through collaborative processes. So I plan to continue those trainings and they'll probably evolve. I usually wait till a few weeks before the training is going to take place, and I kind of look at what is currently going on in this, within organizations, and kind of try to pattern the training around that. And then, of course, as I mentioned when I started, I'll probably also make myself available to support people that are applying for vehicles or other transportation support through the 5310 process, either individually or as a group. So that's about it for me, unless anybody has any questions.
Thank you, Billy, for that update.
Thank you.
Yeah, it's been really interesting seeing all the development on your workshops and the adaptations that you have to have done throughout this couple of years with COVID on how to adjust your topics, and it's been really good to see the evolution not just on your part but also on the other agencies and how they have handled this situation as well. So thank you so much. And lastly, we have here Eric Pennick from the Center for Rehabilitation to provide an update on his work as a mobility manager as well.
Hi, good afternoon, everybody. My name is Eric Pennick. I'm the Fleet and Facilities Manager here at TCH. I'm the newest mobility manager. I started last October, so I'm still very new to this. I'm working very closely with Dawn Hawking, who is our Director of Development. She's been here for about 30 years, so she's very knowledgeable in everything TCH and grant related. The two trainings that we have been working on this year are they're titled Enhancing Mobility Needs Through Technology and Fleet Management and Data Reporting. The first one, it is kind of a dialogue around best practices for the ways you can use different programs and different pieces of technology to help all aspects of fleet management, like maintenance, tracking, and everything in regards to that. The second training, Fleet Management and Data Reporting, is more closely tied to the grant process. It talks about ways to track information to report it on the milestone report in October, along with the applications in February. these trainings are brand new, and the feedback was mixed, which is good. It gives us some goals to aim for the next training. There were a lot of positive comments. People learned a few tips and tricks that they could use in their organizations to help not only take care of the fleet, but help make the application and milestone report an easier process every year. I think that's about it. Unless anyone has any questions.
Yeah, thank you, Eric. Yeah, there's those new workshops that Eric mentioned, being the newest mobility manager, were based also on the feedback that we received from from the surveys that we have sent throughout the workshops, trainings, and tap meetings. So we really appreciate your feedback on that. We appreciate all the work that our sub-region mobility managers have been doing on providing these services to our region and to the organizations in our region as well. So we want to thank all the mobility managers. I see that Marsha here also thanked the mobility managers for the work that they have been doing. If you have any questions about the topics, the workshops that they have been providing, don't wait until the next workshop comes around. They are your resource. They are always available to help you with any of the questions that you have. So, for example, Eric talked about fleet management and technology. So, if you have any questions of how to improve your systems on that, feel free to reach out to Eric, as well as any of the other topics with Billy, Justin, and Mark. They are always available to help you with that. We put the email contact for every one of the sub-regional mobility managers on the slides, but I also put on the chat right now the page where you have all the contact information with the email, phone number for you to be able to contact them. And keep an eye on the workshops that we'll be sending, that I'll be sending your way in the next couple of weeks and months. With that, I'll send you. I'll get back to Didi.
Thank you, Ezekias, and all the sub-regional mobility managers. As you can see, we have a wide range of topics and workshops, from fleet managers to those addressing how you're providing services, and then how we are coordinating and exploring ways where we can coordinate with sharing of vehicles. I just wanted to address two chat items that came in from Garrett and I believe George. At this time, MAC is holding all meetings virtually due to the increase in the COVID that we're seeing in our region. So, but we are definitely looking at what workshops would lend themselves to be able to be better in person. So we are working on trying to at least provide a couple of workshops in person. And I think fleet maintenance is one that would really translate well to in person. Jard asked a question, when will we be getting notification regarding approval? Again, our section 5210 priority listing is going before our MAG Regional Council tomorrow afternoon for their approval. And once we hear that, we will send a notification to the City of Phoenix saying, letting them know about the approval of the priority listing. And shortly after that, applicants should receive notice regarding their grants. The other comment I wanted to address was from Marcia. And actually, this was something that was talked about at the Transit Association roundtable that I went to on Friday regarding, she had mentioned that with the population aging, it is harder for them to get into 12-passenger vans. Are there more minivans in the future? And that was a topic that somebody at the roundtable had brought up, and not only due to the aging of your participants, but also some agencies kind of revising how you're doing your programs, being virtual, and not having as many participants in person. So yes, this is something that they're looking at. They're looking at all aspects of what available fleet will be up for Section 5310 potential applicants. But I would also like to hopefully we can touch bases with Wendy to see if she could provide an update on this topic also. But yeah, thank you, Marcia, for bringing that up. That is something that at the roundtable they were looking at the flexibility of fleet and the availability types of vehicles to be available. Does anybody else have any questions, any comments? I appreciate everybody. I would like to say thank you to all of our speakers and to all of you for attending today. The presentations will be available on the website. Thank you for all of the work that you do. We hope we provided you with information that you can take back to your community, to your organizations, and can provide to your participants. Thank you so much for the work that you do, and I hope you have a great rest of the afternoon. Have a wonderful evening. Thank you, Phil. Have a wonderful evening.
Thank you,
Thank
everyone.
you.